Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have another fantastic guest that goes by the name of Ibraz. Ibraz is a dedicated professional with over 13 years of experience in the medical field. He resides in Texas with his cherished family, and he has collaborated extensively with renowned GI physicians in New York, Houston, and he showcases prowess in sales, marketing, clinical training, and serving as a product specialist. Notably, he contributed significantly to COVID units aiding in GI procedures, and presently, Ibraz thrives as a territory account manager for the Southern U.S. at a prominent medical software company, passionately highlighting the crucial role of AI in elevating medical practices. And that's awesome, right? Because so many people have questions around wanting to enter the software side of medicine as a sales professional and have questions around how does AI fit into all of it and how can I be a part of it? So if that's you, if you've ever been curious about software in medicine and what it looks like to explore that career track, then you absolutely have to listen to this episode. This is an episode for you. As always, we do our best to bring you guests that are doing things a little bit differently in the medical sales space, and I really do hope you enjoy this interview. Hey, Braz, how are we doing today?
I'm doing well. How are you?
I'm fantastic. So why don't you tell everybody who you are and what you do?
I'm currently working with Endosoft. I'm in Texas. Endosoft is, I would say, medical healthcare software company that properly, I would say, give doctors a tool that they can write their report, do their software application through their imaging capture, and we have AI system that Endosoft just introduced a couple of years ago.
So let's get into that. So is that go along with their EMR system, or is that something different?
So we do support EMR system. We have this reporting tool that specialize in any specialty. So we started from a GI. Our owner, our founder, are brothers who also is a GI physician himself. And 30 years ago, they just came up with this idea how we can make this thing easier for doctors who use this report and write reports every day and spend so much time on it. So they came up with this idea and started developing this application.
Very nice. So when you say writing the report, are you talking about when doctors write their notes after they see a patient or after they take care of a case? Like what? Give us a little bit more.
Yes, I would say yes. Initially, that was the idea. After the procedure, they have to remember lots of things that they did during the procedures, and there are lots of scenario that you forget, and lots of mistake happens. So to make it easier, to make it very user friendly, and also with better patient care, you need something strong, something solid. So that was the idea of developing this report tool.
How does the AI play into it?
So 6 years ago, our company, because we are independently owned company and based in New York, upstate, they were just into this software development to how to progress, how to make things easier for doctors, clinical staff, and add to, I would say, advanced tools into it and save their times. So when they added the AI, they started with the polyp detection, which is very common in GI, where you do procedure, you see small tumors, sometimes you miss those polyps, and a couple of years later, it become cancerous tumor. So they developed this tool called AI polyp detection, Argus. We name our AI engine Argus. And when they developed this, lots of other companies started doing the same thing, um, with different helps and different partnership. But because we haven't had any partners, we haven't had any license holder, we are the sole developer of our software applications. We just went ahead and thought about polyp sizing, which is very important factor. When you find polyp, there are polyp different sizings. Sometimes it's very small, and when you do endoscopy, you always see images very magnifying because that's the lens of scope that you use.
Sure.
So we misjudge, missize lots of time, and that also costs patient facilities with their tools and devices. And end of the day, it's not cost effective. So our developer went ahead and started processing this sizing tool into our AI engine, and we are the only one in the United States who has a register and patent on the sizing module.
Wow.
So yeah.
That is fantastic. And so in this space, do you work with a sales team? Are you the only sales professional? How does it work?
So I am a sales and marketing team member for South region. I cover a couple of states in South, including Texas and four more states. We have a team growing up with sales team. We hadn't had uh, that big team before, because our application was so good. So people were just
Just one.
telling, yeah. So each other. We never did marketing. We never did big advertisement or anything, and we never partnered with anybody that just want to spend millions of dollars in marketing, but products are not good. So we never need it. But since we added the AI engine to our applications, we just wanted to let people know that you can advance your practice using these tools. You can save your time because we didn't stop at polyp detection and polyp sizing because, as I said, we are a software company. We can develop, we do coding and developing every single day
Sure.
and tweak on our any issues that we see or we get the feedback from the doctors or clinician, and we added this natural language processing tool into our AI engine. So what it does is, um, I would say, when you're doing procedure, and you have 2 hour procedure sometime, and you have so many things going on in that procedure, from diagnosing, finding uh, the tools that you use, and end of the day, you just sit down on your computer and like start thinking, reprocess and recalling your whole procedure, and so many things you are missing out. And sometimes you delay the next procedure just because you want to write exact report, proper report for better patient care.
Right.
So we developed this AI engine. So while you're doing procedure, we give you this Bluetooth mic, very small mic that you can literally talk to that, like you said, Alexa or Google.
Uh,
We have command words for our AI engine. Is this Argus, wake up and start saying like capture image, 5 millimeter polyp in colon, ascending, or any area of colon, or any different thing that you want to say about the procedure or findings or medicine. It will literally record everything in our application. Once you're done with the procedure, you just sit down on your workstation, you review whatever you said during the procedure, add delete, edit, whatever you have to do with that. You just click on analyze text. It will literally falls into the criteria that's supposed to go there.
Hmm.
So that 15 minutes procedure report become 2 minutes. So you save like end of the day at least hour, 2 hour a day on every single procedure. You spending 10 to 15 minutes, you just getting done in 2 minutes.
Wow. So that sounds pretty revolutionary. I mean, what's the reception
Yes.
been with this product? Are the
Um,
physicians saying, "Wow, this has
uh,
changed everything"? What's been happening?
yes. For GI, we have huge conferences, which is one of them is DDW, and we kind of demo it over there, and lots of people saw it. That time we just started that last I would say module, that is NLP. When today we see and show this demo is totally different, which I will give credit to our developers in IT
Mhm.
who are working nonstop on this and making it easier and easier every day. And we have demoed with this AI engine at many big names in United States, and they are impressed. And soon we have lots of people are about to trial it,
Mhm.
about to use it, about to purchase it. So we have lots of things going on for sure.
Nice. Has a decent size of people used it already, or is it still in?
Yes, they it's been out. We just adding any additional thing that doctor require, because that's the beauty of being a software company. Let's say you want to use it, and you use for a couple of days, maybe week, and you say like, I would like to have certain things in that. We take your feedback, we tweak in a couple of things, and we'll make it the way you want. So it's very customizable for staff and doctors. So we don't just give you the product, hey, use this and that's it, you cannot do anything into it. So that's the beauty of being a software company.
That is very cool. Okay, so how did you get into this space? It sounds like you were more of a SaaS person than a salesperson, but maybe I have that wrong. How did you get into this space? What space do you come from?
So I started in New York City. I lived there for many years. I started thinking I'm gonna do some masters in pharmacy or some different medical field, but I did my weekend jobs in the GI offices, and I'm like, this is interesting. GI is one field that has many variety, many different issues that patient come with. So when I got into it, I just like fall in love with GI stuff. So I started working with my first boss, and he was very good businessman at the same time. So we used to set up practices for GI doctors and clinics. So I did marketing, sales, and at the same time I did the clinical work for him. And I learned so many things over there. And New York is fast paced. And one thing I will tell you for sure, New York will teach you the respect of time, how you respect and don't waste your any minute. So I learned and learned in all these years, and I wanted to do more. So during my learning process, I jump into the different areas, different roles, and I started training people in the clinical space. And same time, I started marketing more on other doctors, that what we use and what we can do about your practice and all that stuff. And then I moved to Texas, my another job. I wanted to do more advanced GI. So I was like, for some time in your life, you have to go a little bit back. I would not say backward, but a little bit back to see what you can do more. And when you go see some different stuff, you learn more, and you want to use that experience in building up your stronger future.
Very true. So as you guys grow now, you know, do you see hiring people that want to be in medical sales in this space?
Yes, actually, we are trying to grow our community in sales and marketing throughout the U.S. We do have some, interviews going on, or some needs that we are expanding our territories. And since we doing AI, lots of people are interested, and
Mm.
people are going toward that route. So because of that, our I would say activities became very you know fast paced. We need more help. So our company are looking into a couple of areas that they may add more team members.
So would you call it more of a SaaS sales role or a
Uh,
medical sales role? If you had
uh,
if you had to define what
as
types of sales professions you're adding.
So I will definitely tell you this. This won't be a medical device role. We are more into like SaaS side of the salespeople. Also, this is software. So I would also want to point out this. Lots of medical device salespeople. I did medical device before,
Okay,
but it was on a small scale and all that.
sure.
But when I moved here in Texas, I learned about medical device in deeper way. I met with, you name it, all these big name companies, reps and directors and VPs, and they will visit, and I will talk to them while we doing procedure. And I work at one of the largest hospital and one of the busiest hospital in Texas Medical Center, and we were the one who used, there are so many tools that we are the first one use their tools. So I learned doing that process that medical device is very straightforward with the doctors.
Hmm.
So you give them tools, they use it, they like it, they tell their purchase manager or whoever, and they go from there. When I came to software, it is different.
Hmm.
Software like includes so many different variety of people. Um, yeah, doctor will love your product. Doctor wants to save their time. Doctor wants to see these AI tools in their practice. But when we go forward, we have to see IT, biomed,
Yeah.
and there are so many security walls and
Mhm.
firewalls,
Yeah.
all these centers and hospitals that we have to convince, we have to give them so many back and forth documentation that they want to make sure we don't get breached by any cyber
Right.
hack or anything. So the process become a little longer than medical device sales. Um, so people when come to this role, they're like, oh, we're gonna get it, we get trained, and we just sell it next month, next week. But that's not the case.
Mm.
Process is longer, but the reward is better.
Absolutely. And so, speaking specifically to that, healthcare software sales is an industry. I mean, that is a discipline. And it
Yes.
sounds like that's exactly where you guys fit. And to your point, a lot of, med device, people from pharmaceutical, people from even biotech, they have stepped into healthcare software sales positions. With
Yep.
this sales cycle that you just described that calls into all these different call points, how long would you say the typical sales cycle is for what you guys are dealing with now?
It depends how fast the IT people are.
Okay.
Honestly, doctors are very ready and aggressive. means like they are willing to get into this a product. But IT may have different scenarios where they want to test in the test environment, they want to run it in the background before they go live. So I would say 3 to 6 months is usual time for the sales in software type products.
3 to 6 months. Okay. Okay. So a bit of a sales cycle. That's some time right there. And
Exactly.
they gotta be, and you're saying that the majority of that time is spent kind of massaging the minds of the IT department to get them to buy into
Yes.
this software.
Exactly.
That's
And I will definitely tell you this. It is longer, so you have to have be patient. You have to have be hungry for your role. Because if you just sit back and relax, like, okay, I contacted so and so, it's in the process. But no, they have so many things, so you have to be on top of it.
yeah,
Uh, Same as the medical devices.
right.
If you sit back, it will delay more.
Right, right. Wow. Ibraz, this was fantastic. This is a really nice insight into just another side of what the medical sales world has to offer. And it sounds like your company is
Yes.
doing amazing things and looking to grow. So, all of you listening out there, you've heard it right from Ibraz's mouth. This is a new product in a well-known industry as far as healthcare sales, but a fast developing industry with healthcare sales.
Yes.
O-
Definitely.
Okay, Braz. We're gonna bring this to a close. I want to ask you 4 questions. This is called our lightning round. You have
Sure.
about 10 seconds to answer. Are you ready?
Let's try.
He said, "Let's try. Let's do it." Okay. So, Braz, what's the best book you've read in the last 6 months?
I wouldn't say the particular book, but I read lots of articles on medical sales and lots of companies like backgrounds in the medical industry. So that gives me exact information what I know about my products.
Well, then share with us what's been the most interesting that you've read lately.
I won't say the names of those companies, but I do go to their reports and data and all that stuff and see where we are. And I will say proudly that we are 10 step ahead of everybody
Hey,
else.
well, that's a beautiful place to be. That's a beautiful place
Yes,
to be. Okay, what about what's the last movie or TV show you've seen in the last 6 months?
I will say Wakanda forever.
Oh, that is a very good one. Okay, the best meal you've had in the last 6 months?
Chicken biryani,
Oh, from where?
my homemade,
Fair
of course.
enough. Fair enough. And then last question: what's the best experience you've had in the last 6 months?
I would say when I with my company, when I met with my team and all that stuff a couple of weeks ago, we introduced all these new tools and we sat down together and we just talk like we are talking in family, like on the dining table.
Yeah,
So troubleshooting and sharing their ideas and all that stuff. No games, no nothing. Straightforward, helping each other.
yeah.
So that's the best experience I would say I have with my company in last 6 months.
That is fantastic. Ibraz, thank you so much for this time with us. We can't wait to see more that's coming from Endosoft and this dynamic product that you guys are selling, and we'll be in touch.
Definitely. Thank you so much for having me.
And that was Ibraz. What a fantastic episode. Wonderful hearing from him. So, if you were listening and you're thinking to yourself, that's exactly what I want to be doing, then you already know what I'm going to say. Visit evolveyoursuccess.com, select apply now or learn more, and learn about our medical sales career builder program. Or if you know that you want to be a part of it, if you've already seen our clients all over LinkedIn celebrating their success with the new medical sales companies that they're a part of, then hit apply, fill out that application, and get some time with one of our account executives, and let's get you into a medical sales position. And of course, if you've been listening to this podcast for any length of time, I'll be very saddened if you ask yourself right now, have I left a review, a 5-star review with 1 or 2 lines about the podcast? Have I done that? If you haven't done that, I'm challenging you to get it done right now. It'll take you a whole 5 minutes, maybe less, and get it done. As always, we're doing our best to bring you guests that are doing things differently in the medical sales space. If this is where you want to be, you need to visit evolveyoursuccess.com and make sure you tune in next week for another episode. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive-level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.